at the time when we were looking at other collaborations with, say, the United States or sending samples to Brazil, that was the time when we were having a lot of backlogs in our system because we didn't have enough capacity at the National Public Health Reference Lab. Since then, we have improved the capacity of the National Public Health Reference Lab. So we are able to process our samples faster and to do more samples. And so we didn't proceed with that arrangement in Brazil because now whatever samples we have coming out of Region 9, we are able to process it at the National Public Health Reference Lab in a faster manner. Similarly for the US, we didn't pursue those avenues because we are able now to process locally. With CARFA, they had helped us by us sending samples to them and they processing those samples for us. We don't have that need right now, but we are using CARFA as a quality control for the testing that we are doing here at the Public Health Lab. So for every X amount of samples that we do in Guyana, we will take some of it or a couple of it and send it off to CARFA to validate that whatever results we are getting here, that they get the same results. In that way, we know that our quality is good. And so we have been sending those samples as a check with CARFA, and we'll continue to do that because we want to ensure that whatever tests we do here is of the highest quality.
All right, Minister. And recently, the new affordable, reliable antigen diagnostic test was approved by WHO, and it is intended for use in outlying areas. Would Guyana move in this direction now that we have the machine that can extract the test samples in 45 minutes?
Yes, because these things, the PCR test remains the gold standard for testing for COVID. So while we have been building our capacity at the National Public Health Reference Lab, there's nothing preventing us from using other testing equipment. So one of the testing equipment that we want to use is these rapid tests that allows for the detection of antigen, meaning the virus. There are other rapid tests that has been around in the country that detects the antibody. Those tests are not the antibody tests. They're used basically for us to know persons who might have been infected in the past. But they are not a diagnostic test. That means they can't really tell you if somebody really have an infection currently. The ones that are more accurate in telling you if somebody has an infection now is the PCR test or an antigen test. And they're now developing antigen rapid tests. We have been in touch with WHO to be able to get some of those equipment with the antigen testing. And we have asked them to get for us the equipment plus 20,000 such kits. We are still awaiting on them to get some final arrangements in place and to know maybe when those test kits would come to Guyana. Once we get those, they're easy to use. They can be easily deployed, say in Region 1, Region 7, Region 8, Region 9. And in some cases, these test results, they take about 30 minutes for you to get back a results. So they're quick, they're fairly reliable. But in case there is something that we cannot determine using this test, then we can always take that sample and do a PCR so that we are comfortable with the results that we are getting back. But to answer the question, yes, indeed what we want to do is to acquire some of these types of tests, the new antigen tests, and to be able to roll that out, especially in the hinterland community where it's a little bit more difficult logistically to take samples, send them out to town, get back the results in and so forth. So we feel this is the way to go. And if there's any difficulty that we are having with those antigen tests, then we do the PCR. At Ocean View, we have a number of things happening there. We are doing some fixing of the sewage system, the water system, and some of the area in terms of when people go in to work there, the decontamination area. So those things we are in an advanced way because those projects were started a couple of weeks now, but they're not completed as yet because it takes some time to set up these sewage system and all that. So that's ongoing. In addition to that, we have a new triage area that we have been working on. So patients coming in would go through that triage area. That should be completed in another week or two. So that would be operational. And then we are also looking at the ICU area. We have the company installing the gas lines, and we are expecting when we finish there that we'll have about 29 ICU beds. So this is ongoing work that we have there. In addition to that, we are going to set up the diagnostic section looking at installing an X-ray unit in one of the rooms there. And later on, we will also install the equipment for a theater. But as it is right now, we are working very rapidly on the ICU. And, you know, we're trying to get that up and running in the shortest possible time.
All right, but can you say what is the exact capacity of the facility as we speak now?
We intend to have, when we finish all the works, we'll be able to have about 198 beds in the facility. And of those beds, 29 of them would be ICU beds. So that's what we are aiming for. So as it is right now, we have an occupancy of about 30 patients or so. These are milder patients that we have isolated there, and if they develop any severe respiratory distress, we are able to move them from the facility and bring them back to Georgetown Public Hospital for care. Once we complete the ICU at that facility, then they wouldn't need to move back and forth between Georgetown Hospital and Ocean View. What would happen is that they can receive ICU care right at that facility.
All right. Recently you held talks with the visiting Suriname delegations. The two states spoke about collaborating to combat COVID-19, and if so, can you just give us a brief on what was discussed?
Well, yesterday we did have a bilateral meeting between the delegation from Suriname and a delegation from Guyana. I was part of the delegation representing the government of Guyana. Our team was led by Foreign Minister Todd, and it also included Minister of Infrastructure, Bishop Wanejil. Our talks basically on the health side, myself and the counterpart in Suriname, we raised a number of issues, and we have agreed that we are going to set up a working committee between Guyana and Suriname to look at all issues relating to health. Some of the areas of collaboration that we're looking at include COVID-19. And one of the things that we want to do is to ensure that our protocols are in sync, that when the border crossing reopens, that our port health authorities can exchange information, and that you know, people can travel safely from one country to another. Those discussions, we are going to continue to have them so that we can synchronize our protocols on reopening the border crossing. So that's one thing dealing with COVID. In addition to that, we have looked at other areas of collaboration, areas such as infectious diseases in terms of malaria, TB, HIV, We are also looking at collaborating on non-communicable diseases such as diabetes and cancer, cardiovascular diseases, and other areas. We have also talked about the possibility of our hospitals collaborating. We do particular types of specialty care that might not be available in Suriname, and vice versa. Suriname is doing things that maybe we can send patients to them for some specialty care. So those agreements, we will work them out as the joint group gets going, and hopefully we'll see closer collaboration where we can send patients to Suriname or they can send to us depending on the specialty. They have also some specialized courses that are normally run there for their health professionals at the degree level and so forth. And we are also working on an arrangement where if there are doctors here or nurses who would like to receive training in Suriname, that we would be able to send some of our personnel across there for those specialized training. So we'll work out a menu, a package of things that we'll be doing. We are scheduled to meet again next week virtually. And so we'll set up the working group, we'll meet virtually, and we'll work out a complete menu of things that the two countries would like to collaborate on.
Right, Minister. And finally, you met also recently with the new PAO WHO representative in Guyana. Now, is there any future assistance forthcoming from this body as it relates to fighting or combating COVID-19?
Well, PAHO has been our technical partner for many years now, and Guyana at various points would have also been at the executive board of PAHO and so forth. So we have been collaborating very closely. The office here in Guyana has been integrally involved in the work of the ministry, and we have several ongoing projects that we are working with them on. COVID is one major area, and PAHO has been very active in assisting the government of Guyana in procuring a lot of our COVID supplies. So things like ventilators, oxygen concentrators, PPEs, and so forth. A lot of this procurement has been done through the PAHO mechanism, and we'll continue to work with them in these areas. In addition to that, we have spoken about strengthening our surveillance measures, and PAHO has a team that is currently working on how we can strengthen regional surveillance, and very shortly, maybe in another week or two, we would be rolling out new protocols on surveillance. We would be recruiting additional persons who can help us to strengthen surveillance for COVID and other diseases in the regions. So you will see that plan being put in place within the next 2 weeks or so. In addition to that, there are many other areas that we work on, and this include creating a new strategic plan. Well, first of all, we have completed a review of the existing strategic plan, and that review, we'll be having a meeting shortly to discuss the findings of that review, and it would form the basis for us to plan the next 5 to 10 years, a vision of where we take health in Guyana. So we're in the process of looking at the findings from the review and then start working on projecting the next 5 years. So a lot of those technical kinds of work was done with our ministry team plus a PAHO team to look at how we move this forward. We have also been working very closely with them on the area of immunization. And as you know, with COVID, our immunization programs would have been slightly affected. So we are now trying to ensure that we mop up and that we keep our immunization numbers high. So we currently have a program where we're sending out staff out to ensure that no child who was supposed to get a vaccine is without that vaccine. And that is going to happen for all the regions before the year is finished. We have also have another program dealing with the elimination of filaria, and we are supposed to do the second round of mass drugs administration for filaria using ivermectin. The staff in the ministry, in collaboration with PAHO, has been talking about the appropriate date for the rollout of this program. So hopefully we can also get that going, and so that once we reach the appropriate percentage, Guyana would be declared filaria free. So we have many programs that we are working on currently, but I just wanted to maybe highlight the a couple of them so that people can get an appreciation of how much work we have been doing together.